Thyroid is a small butterfly-shaped gland in front of your windpipe. It releases thyroid hormone called thyroxine, which controls growth of our body and energy production. Thyroid is under the control of pituitary gland, which is a tiny gland in the middle of your head. Pituitary releases thyroid-stimulating hormone, that is TSH. TSH is the signal to the thyroid gland to release thyroid hormone thyroxine. So, hypothyroidism is when there is low levels of thyroxine in body. Hypothyroidism can be either primary or secondary. When the thyroid is unable to produce sufficient thyroxine despite the increased level of thyroid-stimulating hormone, it is known as primary hypothyroidism. And when the thyroid is unable to produce sufficient thyroxine due to the lack of stimulus from TSH, it is known as secondary hypothyroidism. Women are 8 times more likely to develop a thyroid disorder than men. When you are hypothyroid, your entire body slows down, including your ability to respond to your environment. So, here are 12 common signs and symptoms of hypothyroidism. First is fatigue and sleepiness. This is the classic symptom of hypothyroidism. People with low thyroid feel a distinct lethargic tiredness or sluggishness, which makes them feel unnaturally sleepy even though they have slept well last night. Hypothyroid patients are less able to get deep sleep. This may be the reason of feeling tired and sleepy. So, feeling sleepier more than usual without a good explanation could be a sign of hypothyroidism. You might also note that your reflexes are delayed. Second is gaining weight. Unexpected weight gain is another common symptom of hypothyroidism. Lack of thyroid hormone slows down your metabolism and your basal metabolic rate decreases. Because of this, you may gain weight. Now, if you have been experiencing weight gain, first, you should look for other changes in your lifestyle which might explain this change. And if you seem to be gaining weight in spite of a good diet and exercise plan, it might be a clue to your hypothyroid condition. Third is digestive change. Because your system has slowed down, apart from the weight gain, you may also suffer from constipation, hardening of stools, bloating, poor appetite. Since the food is not moving through your stomach as quickly as it used to move in normal condition, you may experience heartburn and acid reflux. Fourth is cold intolerance. In case of hypothyroidism, your basal metabolic rate decreases, which reduces the amount of heat you generate. This is why low level of thyroid hormone makes you feel colder and more sensitive to cold than usual. So, if you have noticed yourself feeling colder than normal lately, then it might be a sign that you may be suffering from hypothyroidism. Fifth is muscles weakness and aches. Hypothyroid patients commonly complain of muscle, aches and cramps. In hypothyroidism, body breaks down its own tissues like muscles for energy. Because of this, muscle strength decreases and this leads to a feeling of weakness and pain. The pain may be severe enough to wake you up at night. So, the treatment of hypothyroidism helps improve the muscle strength and it also decreases the aches and pain. Sixth is hair loss. Hypothyroidism makes your hair thin, dry and brittle. Low thyroid hormone causes hair follicles to stop regenerating, which results in hair loss. But this will typically improve when the hypothyroidism is treated. Hypothyroidism may even cause coarsening of hair. So, consider hypothyroidism if you experience unexpected changes in the rate or pattern of your hair loss, particularly if your hair becomes patchy or coarser. Seventh is itchy and dry skin. Your skin may feel dry and coarse and it may flake upon scratching. There may be a yellowish tint due to an accumulation of keratin. Changes in skin that cannot be blamed on allergies or the use of new products can be a more practical sign of hypothyroidism. Hypothyroidism is sometimes caused by autoimmune diseases. This can affect the skin, causing swelling and redness known as myxedema. Myxedema is more specific to thyroid problems than other conditions that cause dry skin. 8th is feeling down or depressed. Depression in hypothyroidism is more frequent as compared to hypothyroidism. In one study, it was seen that thyroid hormone replacement improved depression in patients with mild hypothyroidism. 9th, trouble concentrating or remembering. Many patients with hypothyroidism may find it difficult to remember things or to concentrate at work. Difficulties in memory or concentration can happen to anyone, but if it is sudden or severe, then it could be a signal of hypothyroidism. 10th is menstrual cycle changes. If you are a female and hypothyroid, your menstrual periods will probably become much heavier and more frequent or irregular than usual. Both irregular and heavy menstrual bleedings are linked to hypothyroidism. Thyroid hormone directly affects the ovaries and uterus. So, your ovaries may even stop producing or releasing an egg every month, leading to difficulty in conception. Heavy bleeding may even result in anemia. So, if you have irregular or heavy period, do talk with your gynecologist. 11th is voice change. If your thyroid is enlarged, it may even affect your vocal cords and cause your voice to sound hoarse or husky. 12th, changes in fingernails. Your fingernails may become brittle and develop lines and grooves. You may even find it difficult to apply nail paint. So, these were a few signs and symptoms that may be seen in case of hypothyroidism.